Welcome to Hannity. Now, as you know, every night we begin, this is a national emergency that our country is going through. It continues. We start every night with facts without fear, just the facts, and that means the good, the bad, the ugly, what should most concern you and your family. Sadly, at this time, we see the worst in some people, but the majority we see the best in. We're going to name names America needs to know. But we start tonight with an important message from the president earlier today. Take a look.
I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks.
Now, the president's night, we all need to face the truth. Make no mistake, the next 2 weeks, maybe longer, will be rough. Here is where we are up to the minute tonight. In order to prepare, FEMA has now supplied 250 ambulances and 500 EMTs to New York. That is the point of interest right now. It could spread elsewhere. The Army Corps of Engineers, they are developing 8 facilities to expand hospital capacity in California, including hundreds of additional sites across the U.S. FEMA is soon delivering a 250-bed field hospital in the state of Michigan. An additional field hospitals now being built in Louisiana, up to 500 beds as of now, and a 3,000-bed alternate care site. They're building that in New Orleans. Also, FEMA is now also providing 100 travel trailers to help with housing needs, and the administration, they are giving hospitals the flexibility to use new facilities for non-infected people if that is in their best interest. They're on the ground. They need to make those decisions. Now, so far, this country has completed 1.1 million tests. That's more than anywhere else in the world by far, but that is not all. Today, we got more facts without fear from President Trump about America's supply. For example, we've heard so much about ventilators. Let's take a look.
We have almost 10,000 ventilators that we have ready to go. We have to hold them back because the surge is coming, and it's coming pretty strong. And we want to be able to immediately move it into place without going and taking it. We sent a large number of ventilators to Michigan. We're sending them to Louisiana. We sent additional ventilators to New York, additional ventilators to New Jersey.
Now, keep in mind, multiple major U.S. companies are now mass producing new ventilators. Between Ford, 3M, General Motors, over 10,000 additional ventilators will be ready by mid-April. That's coming up. 15 days, with thousands to follow, as much as 50,000 thereafter. And tonight, there are so many great businesses. We do have to stop. These people have gone to bat for we, the American people. They deserve our praise tonight. And more importantly, we owe a debt of gratitude to all the Americans in every corner of this country rising to the occasion, starting with, our military men and women that are now helping. Amazing Americans, National Guard. This is the best our country has to offer. We can see this in the roughest of times. And earlier today, the president saluted the brave doctors and scientists and nurses and all the healthcare professionals. They all put their lives on the line. They do it around the clock, around the country, tirelessly working for the American people in the front lines to beat back this, invisible enemy. Take a look.
I watched the doctors and the nurses walking into that hospital this morning. It's like military people going into battle, going into war. The bravery is incredible, and I just have to take my hat. I would take my hat. If I were wearing a hat, I'd rip that hat off so fast, and I would say, you people are just incredible. They really are. They're very brave.
Now, these medical workers, they have a tough road ahead. All praise to them tonight. And by the way, this brings us to our facts without fear. These are the things that we've got to keep an eye on as a country. We all need to be concerned about. Worry, panic, hysteria, that's not the answer. We got to think strategically. We got to stand back, make the best decisions we can make based on new information evolving every day. Hospitals around the country, they are now being stretched dangerously thin. Protective medical supplies, we are getting reports, are running low in areas. One big concern is more people, younger people, are being impacted. Remember, every single expert for pretty much 5-6 weeks said and reported just the very opposite. Only older people with underlying conditions or compromised immune systems. Now, if the patterns that we see and have witnessed around the world hold in the United States, new corona cases will sharply rise, especially because we're doing more testing than anybody else. Remember, there are people that are asymptomatic. Some people will not even know that they ever had this virus. The death toll will lag behind, but as Dr. Fauci and others said today, we will then see a sharp increase before we see the virus level off and ultimately what we all want, to decrease. We can all get back to the lives we want to live. The White House now predicting it is possible between 100,000 and 200,000 deaths in the U.S., but it could have been 2.2 million. Very interesting charts. Let us hope for the best case scenario. Take a look.
Dr. Fauci, should Americans be prepared for the likelihood that there will be 100,000 Americans who die from this virus?
The answer is yes. We need, as sobering a number as that is, we should be prepared for it. Is it going to be that much? I hope not. And I think the more we push on the mitigation, the less likelihood it would be that number. But as being realistic, we need to prepare ourselves that that is a possibility.
Now, this is why the president extended the social distancing plan until April 30th. All medical experts are saying that will prevent people from contracting the virus, and exponentially, that will mathematically prevent people from ultimately dying. We want to save American lives. We believe in life. We protect the lives of people all across this globe. We've got to protect Americans now. All hands on deck. Now, it is a concerning number, frankly, downright scary. And we hope and pray that we never get there and that lives are saved. Dr. Fauci talked about it. That could all happen, too. And now, because of the president's decisive actions, we have time to potentially curb that number and mitigate this disease. Travel ban, that brought us a ton of time. The quarantines also bought us time. Our current period of social distancing is buying us more time. Now, the thing is, no president has done more, acted more quickly. The book on pandemics has now been rewritten. Future generations will learn from the lessons of this pandemic. Never before have all of these new things happened. Now hospitals and doctors and American businesses, they have time to fight back as they have been. Look at the announcement this week. Abbott Labs creating a 5-minute test that will be a game changer. Studies now underway to determine the effects of new treatments, and a vaccine is already in phase 1 trials. It used to take years to get the sequence of a virus. American ingenuity, brilliant scientists, medical researchers, and doctors. Incredible people, all of them. And meanwhile, also, American businesses have started mass producing personal protective equipment wherever the need is, that our healthcare professionals, that they desperately need, and we must provide for them. And N95 respirators, masks, gloves, shields, protective suits are now being made by companies all across America. Now, this great American ingenuity and hard work is part of the facts that should give you hope tonight. And tonight we have other good news to share. We'll start in California, where after 2 weeks of strict social distancing policies, doctors are now cautiously optimistic that that curve is now flattening out around the Bay Area. And according to Politico, hospitals are reporting fewer cases than they expected to see. That is good as we look at this now, the scary time that we're heading into New York, New Jersey, Connecticut, and maybe some other hotspots around the country. Last week, Washington State, they saw a decrease in the pace of new cases, particularly around Seattle. A lot of good work by the governor out there. Meanwhile, in Italy, Europe's coronavirus epicenter, well, new cases have finally of the virus begun a process, we hope, of leveling off, and we are now at a 2-week low. And according to a brand new study from a medical journal in the United Kingdom, the death rate, they say, for COVID-19, those cases could be as low as 0.6%. Now, let me be clear. We're now in an uncertain time, but what is certain is the might, the will, the power, the ingenuity of you, we, the American people. Soon this invisible enemy, it will be defeated, but hang on tight. The next few weeks will definitely be rocky. And that's especially true in the state of New York, where we are tonight, which is now the epicenter at this moment of the disease. And today, the state released a statement, once again blaming the federal government. They released this statement. The states were not slow to respond. The federal government was absent. Okay. Andrew Cuomo, you were missing in action. Mayor de Blasio, you were missing in action. Really? You have the highest per capita taxes in the country, New York State and city, and virtually zero stockpile of equipment, masks, gloves. Nothing. The stockpile of ventilators, totally insufficient, and the states had fewer ventilators on hand than the national average. In fact, former Lieutenant Governor of New York, Betsy McCoy, points out that Cuomo was warned of the shortage of ventilators in 2015. They only had 2,000. The task force recommended they needed 18,000. So instead of buying 16,000 more, Cuomo did nothing. And now he's screaming at the president, who's building hospital after hospital, sending all the ventilators that he puts in a warehouse. Now he's lecturing the president. Wow, that's why the federal government sent over 4,000 to you that you stuck in a warehouse, multiple emergency hospitals. We now have the USNS Comforter right there in New York Harbor, and it gets even worse. Cuomo barring New York citizens. This has got to end. Hospitalized, if you're not hospitalized, the last place you want to be is in a hospital right now, if you can prevent it. But now the only place you can go in the state of New York to get hydroxychloroquine is at a pharmacy, and they're not allowed to give it to you. That's right. Governor Cuomo, rescind that order and take responsibility. Why didn't you buy those ventilators? You spent $750 million on a failed solar panel project in upstate New York. It went belly up. Why didn't you spend money on gowns? Really? You're going to attack the president, the federal government in the middle of an emergency? You also take responsibility for your poor planning. New York is the #1 terror target in the entire world. New York should be prepared. The first Trade Center attack, 9/11. New York, highest concentration of 10 million people, smallest geographical location. In a pandemic, New York City is ground zero, an international city.